Right.
Mr. Speaker, I rise today in support of the American Health Care Act. Obamacare has failed, and we need to replace it. It has made health care inaccessible for many of the Americans it is created to help. Our premiums have skyrocketed. Small business growth is stunted as they cannot expand due to health care regulations, and employees are seeing their hours cut. Individuals are forced to purchase health care coverage they do not want. Over the past 2 years, I've met with many Nebraskans in my district, and I keep hearing about the broken promises of Obamacare and the tight stranglehold this law has created for the American people. I've heard from a young mother who had to pay for the whole bill of her delivery of her child. The ACA plan she was on had a $12,000 deductible, and that plan didn't help her 1 cent. Another citizen from Omaha, Janine, was happy with her health care insurance for decades. 5 years ago, she was paying $323 a month and was satisfied with the coverage that she had. 4 years ago, she was told by her insurance company that she would have to pay more because she would need additional coverage, like maternity coverage, even though she was past that stage in her life. 2 years ago, that insurance plan of Janine's jumped to $690 a month, double. However, her health insurance company had another policy under ACA which she could switch to, and she did so for $150 a month with a $550 credit. At least she had that plan until her insurance company dropped that ACA policy and sent Janine searching for another policy. Now Janine is on an ACA policy that covers her primary care, her primary doctor, but not her dentist nor her pharmacy. All Janine wants is a health care plan that fits her needs. She does not want the federal government telling her what coverage she must purchase. Imagine for just a second that you've been happy for decades with a product you use, and one day the government comes in, tells you that you don't know what's best for you. They force you to pay more, and in return you get something that doesn't work. ACA is like the government telling you that you need to buy an expensive, fast, shiny sports car with all the bells and whistles, when all you wanted was a less expensive economy car to get you around town. But here you find out that that fancy sports car is actually a lemon. That is exactly what happened to Janine and countless other Americans when Obamacare forced them to coverage they did not want or that they needed. This is more than a failed system. It is wrong to the core, and this is what the American Health Care Act is designed to fix. The American Health Care Act is a step in the right direction, and we are fulfilling our promises to repair the problems that ACA has left us. This legislation repeals major flaws of Obamacare, such as employer and individual mandates, letting individuals choose what coverage is best for them. Under this bill, health savings accounts will be expanded, and will give tax credits for those who buy their own insurance to give them parity with those who get employer-provided coverage tax-free. These are things that I campaigned on and promised to fight for, and it's in the bill. The bill also gives states more control over their health care policies, allowing for patient-centered health care and getting the federal bureaucrats out of the discussion. The American Health Care Act instead allows for individuals to choose the health insurance plans based on their needs and budget, allowing for Americans to have greater access and to find a health plan that is right for them. And the CBO shows that's going to lower those premiums by 10%. You know, Nebraska had a 51% increase last year, Mr. Speaker. This plan is going to lower premiums by 10%. The American Health Care Act will reduce the deficit and cut taxes. According to Monday's CBO score, this bill reduced the federal deficit by $337 billion and lower taxes by $883 billion. That's good for America. Finally, the American Health Care Act does this and yet preserves affordable insurance for those with pre-existing conditions and maintains a safety net for those who cannot pay premiums. These are things that I also promised to fight for, and they are in the bill. I look forward to working with my fellow House members on both sides of the aisle to deliver the best law for the American people. And we're going to be debating this bill for the next few weeks, and we're going to make it better. But I am proud that this Congress and the Republican leadership has made a commitment to passing this legislation in an open and transparent process. This is a good first step towards fixing the mess that ACA, and before we vote on this, I encourage my colleagues and the American people to carefully read the bill so you can find out what is in it. Unlike Obamacare, we don't have to pass this to find out what's in it. We know now. This is a great step forward, a patient-centered, doctor-supported healthcare system. It puts power back to the states and gets the bureaucrat out of our healthcare decisions. Thank you for the opportunity to speak on this, and I yield back.